or it's not as common and is not as well accepted.
Not common. And so
they'll
that's
want to
just
do
that
their
vicious
standard
cycle.
treatment first. Like a radiation therapy department, they'll want to do their standard radiation when they see the patient the first time. And
But with something like this, I could see that it could be very early stages. And
That's right.
you could use it. But by the time a patient arrives at Gamma West,
Mm-hmm.
they are normally in an advanced stage of cancer.
well, that's not, see, they do a lot of primary radiation therapy there.
Right.
So they do
Well, in terms
first
of
line.
hyperthermia,
But you're right.
If they're a
For
hyperthermia
their-
patient,
Yeah.
they're normally, by the time they arrive at Gamma West, it's in advanced stages.
Normally that's true. There are times where patients might become more educated, and there are examples of some patients there that have decided, I want to have hypothermia with my first course of radiation.
Yeah.
And Gamma West is capable of doing that, and they're able to do it, but that's more of a patient's decision and choice with their own education. Normally, a radiation therapy department, even like Gamma West, would usually focus on the radiation as the primary method that they're going to use for the first time treatment. Unless it's aggressive, advanced, or fairly widespread. If they felt, I mean, like some of the head and neck cancers they might run into are not going to respond very well even to first time radiation therapy. I mean, they're not going to be surgically resected or you really disfigure someone. And so that's a condition where they may choose to recommend hyperthermia to boost that effectiveness of radiation.
But it doesn't have to be advanced stages.
No, it doesn't have to be.
That's right.
Yeah.
In Europe, is it common just
Yeah.
regular?
Well, it's like I said, in the Netherlands, cervical cancer patients now in the Netherlands automatically when they're going to have radiation therapy, hyperthermia is standard of care in the first line treatment with radiation on cervical cancer patients. Throughout Germany, I was talking about soft tissue sarcoma, where they're not recurrent patients that they're wanting to treat. A lot of them are the first time soft tissue sarcoma treatments, and they're quite effective. Where you see the biggest difference sometimes is on recurrent or advanced patients, where clearly they're not going to respond very well with the standard therapies. So when you add hyperthermia, you really see the big boost of the results.
Yeah.
With primary first-line patients, many times there's fairly good treatments already with radiation, surgery, or chemo. And so when you add hyperthermia to that, it may improve things, but maybe not as dramatically as you might see for these advanced patients that are normally going to fail those standard treatments.
So I'll just